Today we're going to be discussing delegation, which is chapter 4 in your textbook. Delegation is the process a nurse uses to direct a nursing assistant to perform a nursing task. When you are delegating, you are transferring authority to a person for a specific task. Nursing assistants function under the supervision of licensed nurses. Nurse Practice Acts give nurses the right to assign or delegate nursing tasks to nursing assistants. A nursing task is nursing care or nursing function, procedure, skill, or activity. A routine nursing task is a nursing task that is part of the nursing assistant's routine job description and commonly assigned to a nursing assistant. A nursing task that was learned in a nursing assistant training and competency evaluation program is a routine nursing task. The word delegate means to authorize or direct a nursing assistant to perform a nursing task. A delegated nursing responsibility is a nursing task that a nurse transfers to the nursing assistant when it does not require a nurse's professional knowledge or judgment. Routine nursing tasks and delegated nursing responsibilities must be allowed by the state and included in the job description. If not learned in the NAT-CEP program, the agency must provide education and training on how to perform the task and evaluate the CNA's ability to perform the task safely. Some states allow nurses to delegate tasks that are not routinely done by nursing assistants, such as inserting Foleys and tube feeds. What tasks can never be delegated to the CNA? First, the nursing process, which is performing assessments, developing care plans, and evaluating responses to care. CNAs cannot provide education to the patient and or family. CNAs cannot perform nursing tasks that require a nurse's professional knowledge and judgment. CNAs cannot make delegation decisions. CNAs cannot supervise others. CNAs cannot take oral or phone orders from doctors or advanced practice providers. CNAs cannot give medications, and CNAs cannot insert IV catheters. Licensed nurses can delegate. The delegating nurse is legally accountable to the patient or resident. The delegating nurse must ensure that the nursing task was completed safely and correctly. An advanced practice provider can delegate to RNs, LPNs, and nursing assistants. An RN can delegate to LPNs and nursing assistants. An LPN can delegate to nursing assistants if allowed by the state's Nurse Practice Acts. Routine nursing tasks and delegated nursing responsibilities must be within the nurse's scope of practice, within the nursing assistant's range of functions allowed by the state and listed in the job description. The word accountable means to answer to oneself and others about his or her choices, decisions, and actions. A CNA cannot delegate. The CNA can ask someone to help, but he or she cannot ask or tell someone to do their work. Also, the CNA cannot reassign a task or redelegate a nursing responsibility to another nursing assistant or worker. For safe delegation, the person's needs, the nursing task, and the staff member doing the task must fit. The nurse decides if the task is safe for the CNA to perform. Delegation decisions must result in the best care for the person. There are 4 parts in the delegation process. The assessment of needs. During this part, the nurse collects information about the person's needs and the CNA's knowledge and skills. The nurse decides if it is safe to delegate the task. The next step is communication. The CNA and the nurse discuss the task. The nurse makes sure the CNA understands the directions. The CNA communicates questions, concerns, and progress to the nurse. The CNA reports and records the care that is given. The third part in the delegation process is guidance and assistance. During this part, the nurse observes care, makes sure tasks are completed correctly, and monitors the person's response. The nurse follows up on problems or concerns. The final part of the delegation process is follow-up and feedback. During this part, the nurse decides if the delegation was successful. The nurse makes decisions about possible changes in the patient's care, and the nurse provides feedback on how the CNA completed the task. The delegation process, assessment of needs. The nurse must understand the person's needs. The nurse needs to know the CNA's knowledge, skills, and job description. To assess the person's needs, the nurse answers the following questions. What are the person's needs? How complex and urgent are they? What are the most important long-term and short-term needs? How much judgment is needed to meet the person's needs and give care? How predictable is the person's health status? How does the person respond to health care? What problems might arise from the task? What actions are needed if a problem occurs? What emergencies might arise? How involved is the person and family in healthcare decisions? How will delegating the task help the person? To assess CNA knowledge and skills, the nurse answers the following questions. What knowledge and skills are needed to safely complete the task? What is the job description? What are the conditions affecting the task? What is expected after the task? What problems can arise from the task? The delegation process communication. During this part, the nurse must provide clear and complete directions about the task. The nurse must ask questions to ensure that the CNA understands the task. During the guidance and assistance part of the delegation process, the nurse supervises the CNA's work. The nurse must be available to guide and assist as needed. In the last part of the delegation process, follow-up and feedback, the nurse decides if the delegation was successful. To follow up means to review and take needed action. During this part, the nurse answers the following questions. Was the task done correctly? Did the person respond as expected? Was the result as desired? Was there timely and effective communication? What went well? And does the care plan need to change? The 5 rights of delegation for nursing assistants are as follows. The right task. So does the state allow you to perform the task? Is the task in your job description? Were you trained to do the task? When delegating, the nurse must ensure that the patient's health, safety, and welfare will not be jeopardized. Next, the right circumstance. Does the CNA have experience with the task given the person's condition and needs? Does the CNA understand the purposes of the task for the person? Can the CNA perform the task safely under the current circumstances? Does the CNA know how to use the equipment and supplies? The third is the right person. Is the CNA comfortable performing the task? Does the CNA have concerns about performing the task? The fourth right is the right directions and communications. Did the nurse give clear directions and instructions? Did you review the task with the nurse? Does the CNA understand what the nurse expects? Delegated tasks should be communicated with the CNA on a person-specific basis. Finally, the last right of delegation for nursing assistants is the right supervision and evaluation. Is the nurse available to answer questions? Is the nurse available if the person's condition changes or problems occur? Did the nurse evaluate the results? The nurse retains responsibility and accountability for the care of the patient even when tasks are delegated. When you accept a task, the CNA must complete the task safely. However, the CNA has the right to refuse or not accept a delegated task. A CNA can refuse when the task is beyond the range of functions for nursing assistants allowed by the state. The task is not in the job description. The CNA was not trained to do the task could harm the person's condition has changed, the CNA does not know how to use supplies or equipment, the directions are not ethical or legal, the directions are against agency policy, the directions are not clear or complete, or if a nurse is not available to guide and assist as needed. A CNA may not reassign a task that has been delegated to him or her.